Always exercise and adjust the straps from the front side of the device. The front and back are clearly marked. The warning signs attached to the ends of the ropes have important information about adjusting the straps. It is particularly important to learn to release and lower the straps from a reclining position. Once they are locked, the ropes will never give way or slide. The fact that Therapy Master's straps and slings are easy to adjust is a great advantage to you as a therapist when adapting exercises to your patients. For patients, it is easy and safe to exercise on their own using the same equipment they have been trained to use through their treatment. The straps function to suspend arms and legs. The principles for releasing and locking the ropes apply in all positions: standing, sitting and reclining. Insert the user's hand or foot into the strap from the back side, where the opening is narrower, in the same way as in the strap of a ski pole. The strap should cradle the user's hand or foot comfortably. To be able to use the Therapy Master effectively with your patients, you should practice releasing, raising, lowering and locking the straps from both a standing and reclining position. Adjusting the straps while standing. Release and lower the straps by holding them in one hand and the middle ropes in the other. Gently pull the middle ropes straight down until they loosen and then toward you. Holding the ropes taut, pull the straps down to the desired height. Do not jerk them. Gentle movements work best. Let the middle ropes go so that they hang straight down and the straps will lock when a load is placed on them. Raise the straps by pulling the middle ropes straight down until the straps are at the desired height. Let the middle ropes go and the straps will lock when a load is placed on them. Adjusting the straps from a reclining position. Raise the straps by pulling the middle ropes straight down until the straps are at the desired height. Then, bend your knees and push your arms toward your feet. Let the middle ropes go and the straps will lock when a load is placed on them. To release and lower the straps, pull the middle ropes straight down until your legs are raised slightly. Keeping the ropes taut, pull them toward your head. Do not jerk them. Then lower your legs to the desired height. Then bend your knees and push your arms toward your feet. Let the middle ropes go so that they hang straight down and the straps will lock when a load is placed on them. Therapy Master can be moved above the treatment table with the aid of the sliding suspension system. Pull the locking rope straight down and into the cleat. The traverse with the Therapy Master will now slide freely along the tubes. Move it to the desired position and pull the locking rope down and out of the cleat again. For better support when treating patients or exercising, the Therapy Master system also includes a number of different slings, ropes and elastic cords. The slings are fitted with rings to make it easy to switch between various ropes and elastic cords. Simply hook the rope or elastic cord desired to the sling. Then hook the cleats of the sling onto the ropes with the straps. The cleat is specially designed for the Therapy Master system for simplicity and safety. First, thread a rope over the lower hook and move the cleat up or down to the correct height. Then thread a rope behind the upper hook and the sling is locked. For subsequent adjustments, take the rope out to the upper hook. Adjust the height and thread the rope back behind the hook again. Notice how easy height adjustments are. When additional slings are going to be used, it is important, for the sake of effectiveness, to follow certain procedures. This example shows a typical treatment situation in which two narrow slings are used under the knees and the wide slings under the hips. Raise the table. Lower the straps to the support surface. Insert the feet into the straps. Hook two narrow slings onto the ropes and adjust the slings so that the bottoms of the slings are at the same height as the bottom of the straps. Once the legs have been raised to the desired height, the knees become bent at an angle favorable for relaxation exercises or gluteal races. Then hook the cleats of the wide sling onto the ropes of the narrow slings. If necessary, adjust the cleats afterward so that all the slings are at the correct height in relation to one another. Lower the table, raising the hip area from the support surface. On the underside of the Therapy Master Professional, there are two pulleys that make friction-free rotation exercises possible. Line up the pulleys and thread the black rope over the wheels. Attach the desired sling and adjust the height to the exercise to be performed. During exercises that involve raising parts of the body or bearing the weight of the body, the patient can get help to perform movements and improve their quality by using elastic cords attached to the slings. The elastic cords with hooks and cleats are available in high and low resistance versions. Elastic cords on the slings provide negative weight or reduced resistance, enabling the patient to perform a particular exercise without pain. Elastic cords can also be used to perform exercises with resistance throughout the entire path of the movement. For adding resistance to exercises via a horizontal pull of the rope, we recommend the Therapy Master telescopic pulley. Lightweight and movable, it can be set up at the desired position next to the treatment table. Raise the foot pedal, adjust the height, tighten, and push down on the foot pedal. The pole will now be locked between the floor and the ceiling. Hook the strap on a separate black rope around the patient's leg or arm. Then thread a rope over the pulleys on the pole's two adjustable arms. Adjust the height and angle to the desired position so that the pull is in a proper plane. Then attach one or more weights to the rope. The weights come in 0.5, 1, 2 and 2.5 kilos. The patient can perform the movement while Therapy Master holds the weight of the body part. The ropes in the Therapy Master can be released from the rope locks. Pull the ropes down and toward you. Push the rope release in under the ropes. They will now move freely.